Hello friends, I am Dr. Sunil Patil. I am consultant urologist, endocrinologist and renal transplant surgeon at Athaayu Uro Care Center, Thane. Today I am going to give a brief introduction about urethroplasty surgery. So the urethroplasty surgery is usually done for urethral stricture disease. As discussed earlier, there is another modality for urethral stricture treatment called VIU, but it may not be appropriate for all patients. The other set of patients which are not appropriate for VIU, they usually need urethroplasty surgery. So the indications for urethroplasty are usually patients having long segment of urethral stricture, which is long segment means more than 2 cm segment stricture, which may be involving the whole segment of the urethra also. Also in those patients of short segment stricture whereby it is not getting treated completely with VIU, or even after doing VIU the stricture is coming back again and again, those patients may need urethroplasty. Also female patients who have urethral stricture needing repeated dilatations or recurrent dilatations, or patients who are not willing for recurrent dilatations, they need urethroplasty surgery. Also another important subset of patients requiring urethroplasty are those patients who have stricture due to trauma, accident or any injury to the urethral area leading to stricture. So these subsets needing urethroplasty are usually evaluated first with all the basic investigations, a urine culture and the X-ray test called RGU-MCU, the full form of which is retrograde urethroplasty and micturating cystourethroplasty. So this X-ray procedure is very important in determining the segment of the stricture, the location of the stricture, which helps in guiding us the modality of the treatment. Urethroplasty we usually divide into two types. One is for traumatic strictures or strictures happening due to accident or injury to the urinary tract. Those patients need a type of urethroplasty called end-to-end urethroplasty, whereby the segment of the stricture which has got traumatized needs to be cut and excised completely, and the healthy ends of the urethra needs to be joined together using sutures. Another subset of patients having strictures are long segment strictures, usually due to a sequelae of long standing Foley's catheter or due to long standing repeated urinary infections leading to urethral stricture. These subset of patients usually need a urethroplasty called buccal mucosa graft urethroplasty or any other graft urethroplasty like lingual mucosa using graft from the tongue, or it may be prepucial graft, which is graft using the foreskin. The graft is usually placed after the urethra is cut open and the graft is sutured to the cut open margins of the urethra, whereby the urethra becomes inherently bigger due to the width of the graft. After the graft is placed and sutured, the patient has Foley's catheter inside, which is usually kept for 4 weeks, after which it is removed and the patient is able to void properly. This urethroplasty surgery is a complex procedure. It is a branch of urology called reconstructive urology. So the patient needs to get treated for such patients only from trained reconstructive urologists. We at Athaayu Uro Care have facilities for all types of urethroplasty surgery, including complex urethroplasty surgeries, which we do regularly. Thank you.